much for coming.
You bet. When this was arranged, I was asked to kind of go through the IEP process, and typically we provide trainings on IEP programming for all of our educators in Kent ISD, and it's a full day training, so I'm going to try and get through some of this in about an hour. So if you have questions as we're going through, I'm going to briefly touch on a lot of these topics because I won't have time to go in depth. So if you have any questions, please try to keep them, maybe write them down or whatever, and ask at the end, and I'll be happy to answer them. And if you have further questions, I'm always available via email or via phone at Kent Intermediate School District. So let's go ahead and get started. The IEP, these are all components of the IEP that you would see teachers, parents, all the team members go through. Now, you may be part of those teams as you're working with your students. So this could be helpful for you as far as understanding what is included in an individualized education program. Student profile and eligibility. This is all right on the first page of the IEP. Pretty much what we're going to do is get the student strengths, any parent concerns. Now these things can all be drafted ahead of time, so it doesn't have to necessarily be discussed there. It's ideal that the parent would provide input prior to the IEP meeting, so it's not a very lengthy process. I was at one last night until 8 o'clock at night, and it started at 3:45. So they can be very long. It depends on what the needs of the students are. So we always go through the current evaluation, and then eligibility determination is done at the IEP meeting, not prior to. Even though there are evaluations that are done, those are all just data points that go into determining eligibility. The actual determination of eligibility happens at the IEP team meeting with input from all members. And that's been a little bit contentious. We really try to stay away, and we're probably going to do a little more training next year on what's called predetermination. And again, that decision is made by every member of the IEP team. Now, there is a final offer that is made by the district, but there can be dissenting on letters included, etc., if everybody doesn't agree with that determination. Again, I just talked about this a little bit, but when you have your 3-year reevaluations, it's really, because it's determined at the IEP meeting, it doesn't go from evaluation to evaluation. It goes from IEP. That's when the 36 months start, and that's in IDEA as well as in the Marsh Rules of Michigan Administrative Rules for Special Education. That it's a 36-month timeline, but it starts from that offer of FAPE, or a free appropriate public education. If I speak in acronyms, stop me, because we do speak in acronyms, so I'll try to explain that as we go through. Transition. A lot of the students you're going to work with, I'm sure, are getting to that transition age. We recommend that transition discussions start sometime in the teen years, and early teen years is preferable. Now, what the rule or the law says is that it doesn't have to be in effect until a student turns 16. So anytime there is a student that is 15 years old at an IEP, there has to be a discussion of transition, because during the course of that annual IEP, they will turn 16. Okay? So anytime a student is currently 15, there has to be a discussion of transition, and that means moving out into the real world. So we recommend it, in 8th grade, and the transition activities are going to drive a lot of issues that occur in the IEP, i.e. whether or not the student is going to graduate with a diploma, is the student going to get a certificate of completion, what are the post-secondary goals? In other words, what are you looking for that student to attain? It could be as little as being able to take care of themselves individually, independently. Or it could be something where the student's planning on going to college, and we're getting more and more of that as we have like lower levels of ASD, learning disabilities, ASD, autism spectrum disorder. Who requires a transition? All public school students, all charter school students. Anybody who receives funding from the state and the federal government requires a transition IEP. Non-public school students do not require a transition IEP. And of course, you go through all the assessments. Now again, there's a number of different assessments that can be administered, but the idea is to find out what the student's desire is, and then to try to map that through the IEP process as to what goals and objectives you're going to work on, so that the student can be successful in what their desire is post-secondary or post-school age. In planning asserts, this is important. Students rights transferred to 18, regardless of their disability, at 18 to them, regardless of their disability, unless there are court orders in place, okay? They have to be informed, as well as the parent has to be informed. Could be a surrogate, whomever is serving as that parent at the time, has to be informed that their rights are going to transfer prior to them transferring, so at age 17, and after they've transferred at 18. And they have to be notified, the parent and the student. The idea is that the parent may want to start some of those court proceedings. We've had students that, this has not been started with, they're cognitively impaired and really can't make their own decisions educationally or even for what their course of study is going to be. So the parents really have to take that proactive mode in those students, especially with those students that have a more significant disability. Again, community agency involvement, okay? This is typically, would possibly be Hope Network, but it's typically like Michigan Rehabilitative Services, MRS. They have to be invited, but there has to be permission. They have to gain permission from that parent in order to invite them, and this has to be done whenever there is a need that they are going to either pay for services or provide services for the students and after they're done with their education. Okay? So anytime there's a need, a lot of times we see that, this is unfortunate, but go through the IEP real quick and they say, oh, there's no need for this. Well, if they're going to, because it takes a little bit of extra time and effort to get these people at the table. So it's very important that anytime there's a question that we do get permission to invite. It doesn't mean they have to attend, it's that you're following, or we're following our requirement for inviting the community agency. Again, the post-secondary vision and transition activities. These are the 4 areas. Again, stop me if I'm going too fast, but I want to get through all the slides. So these are the 4 areas that have to be considered. It does not mean that they have to have goals and objectives with them, but those are the 4 areas that have to be considered for transition planning. And that would be whether or not there's training needs, education needs, employment needs, or independent living. Now, there has been a lot of legal cases where they've been addressed that a lot of these were not considered. The last ruling came down that there's only a requirement that employment has to be addressed as well as education, but they can be addressed simultaneously. Okay, so there could be an employment and education goal or activity in that IEP, only one. And the requirement is that there's only has to be one. Now, that could look very different depending on the disability of the student. If a student's very high functioning and they want to go out and go to college, that their transition goal could very well be that they're going to improve their math skills so that they can be successful in college, or improve their reading skills so that they can be successful in college. It doesn't mean that they have to be a separate goal for transition. It could be incorporated into their educational goals. The post-secondary vision starts the present level of functioning, the PLAF statement. You'll see, I don't know if you're familiar with the IEPs and the way they look, but the PLAF statement is really where the whole IEP is driven from. If you think of it as a broad picture, there's 3 components. There's data, there's the evaluation data, the assessment data, that drives the PLAF statement. What are the needs of the student? What are the present levels and what are their academic needs? Which then drives the goals and objectives and the activities that are put into the IEP itself. So very important that transition, when the students get to be this age, this is going to drive the PLAF, because that's really what you're looking to address, is what are they going to do currently and in the future. Interests are areas where a student has a skill or wants to gain a skill, and preferences are what the student would choose. Now, we have to be realistic with this. And I've worked with students before that are, have and this is, IQ of 50, and their interest is they want to be a veterinarian. Okay? I've seen IEPs that have said, student wants to be a vet. Well, the chances of that occurring are probably slim and none with a cognitive impairment such as that. So it's very important that teams or members that deal with the child are realistic with them and say, oh, that's wonderful. We love the fact that you want to deal with animals, and that's obviously what is driving you. Have you thought about looking into caring for animals, looking at a zoo employment or something along those lines, so that you're not, we don't want to say, oh, you're never going to do that, kid, but On the other hand, we kind of know that, veterinary school is probably one of the hardest schools to get into post-secondary. A student with a 50 IQ who's not passing classes, who's on a certificate of completion class, is not going to be able to get into veterinary school. So it's very important that we're very realistic with the students and the parents, and it's a tricky conversation. Transition itself is tricky. It is very difficult. It's a very difficult conversation to have with a parent. Nobody expects that when that child is in the belly that there's going to be something that may not be 100% perfect. Well, when you get to the point where you start talking about whether or not the student's going to go on to get a high school diploma, or the student's going to get a certificate of completion and maybe have just some training needs or not, that's a very difficult conversation to have with parents. And it's probably the most tricky with special education students. The conversation with the parents is about that time when you start talking about what are we going to do for life. And it kind of really hits home, and it's important because it has to be in place, and then we have to have activities that drive the educational program forward that's going to best fit the needs of the student. And if we sugarcoat it the whole time, we're not doing that. And I know that it's, we have a lot of parents, and by all means, we should always err on the side of getting a diploma. However, sometimes it's not realistic. So just a heads up, that's probably one of the trickier conversations to have. Always obtain the answers to the questions prior to the IEP team meeting. Again, draft everything that you possibly can, but you can't predetermine. At least one measurable annual goal must be identified that's aligned with the post-secondary vision. Now, we talked about that a little bit earlier. They should always address education and employment. Well, again, that's going to vary greatly depending on what the course of study is for the student. And there must be transition activities developed to move the student toward the post-secondary vision. And you should always address all areas that will reduce barriers that the student may have. Student's course of study. Again, as always, address the transition IEP, the date of graduation, the course of study, and that's that tricky one. It's a diploma, certificate of completion, career readiness certificate, certificate of attendance. A lot of kids stay until they're 26. They just age out, but we still want to address what they're going to be working on during those times. And then how the study supports their vision. Okay, this is what we talked about earlier, the PLAF. It used to be a PLAF, it was a present level of educational performance. There was a number of different acronyms, and now it's a present level of academic achievement and functional performance. It's an awful acronym. I had a guy record a video for us on the PLAF, and he refused to say it. He's like, I can't say PLAF. That's ridiculous. So, but it is what it is. And excuse me. You always refer to the Common Core State Standards if the student is in that type of study. The only time they would not be is if they're very low functioning students with cognitive impairments or low functioning autistic spectrum disorder or severely multiply impaired students. Those would be functional and adaptive needs. Other than that, we should always look at the Common Core State Standards or GLCEs, whatever we're using now. Recent legislation, we're not quite sure, but we've been preparing for the Common Core State Standards. Data sources, the educational need, very important, the starting point for instruction. PLAF should pass a test, and that means you should be able to walk into any convenience store, any hospital, and hand a PLAF to a person and say, can you tell me where we should start instruction with the student? And anybody without educational knowledge should say, yep, I know. This is what the student needs, this is where he's deficit, and this is where I start. Now, it also shouldn't be 18 pages long. I've seen those too, where there's a 12-page PLAF, and you're reading it, and you get lost in it. So they should, if you think about it this way, they should be parent-friendly in almost all cases. And it should be easily read. We'll kind of get through this. I'm going to skip over this a little bit. Again, there are academic areas addressed in the PLAF, and this is why it says functional performance as well. There are functional areas that may be self-care, social skills, behavior, or adaptive functioning. Now, there has to be adaptive functioning addressed for all students with cognitive impairments. The purpose of the PLAF is to identify, first of all, the foundation. It's the foundation which the rest of the IEP is built on. The impact of the disability on involvement in progressing in the general curriculum. And each area in the PLAF must be addressed in at least one of the following areas. So if there's an area of need identified in the PLAF, okay, student has a deficit in math, there either has to be a goal, a service, or an accommodation in that area that's addressed in the plan. So when you get, we talked about the 12-page class, they also come with 13 pages of goals, because every area that's addressed in there has to be addressed in one of these 3 ways. Is that feasible to accomplish in a year typically? No. And that's the whole thing, is we can get sometimes carried away based on parents' wants and needs and don't really think what's going to be best for the student. And parents are becoming more and more educated and come in and say, well, these are my rights to vote. Yes, it is. But there's also the right of the district to say, or whoever is operating the district to say, this is our offer to you, what we can feasibly achieve in the course of a year. There are 4 elements of a PLAF, and every PLAF must include these 4 elements. Again, there's baseline data for each area of need. Okay? Now again, just because we have somewhat of a lower functioning area does not mean it's an area of need that can be accomplished in the course of an annual IEP. A description of the starting point for instruction, the areas of educational need, and the impact statement. In other words, how the disability affects the student's involvement and progress in the general education curriculum, and achieving their goals and objectives. Okay, baseline data could be tests, it could be classroom performance, it could be observation, and it can be provided by nearly anyone who works with the student. It does not have to be all educationally relevant material. If there are outside diagnoses, those should be taken into consideration. It doesn't always mean they're going to transfer over into an educational diagnosis, because again, we're in the mission of educating, and we have to really focus on the educational components and not as much on the clinical components. However, most times they will rear themselves in the educational arena as well. But it's not always. We get that a lot with students who have been diagnosed with emotional issues or maybe high-level ASD, where the parents, and rightfully so, they are clinically diagnosed as such, but if there's no educational impact, there was a student that was diagnosed with a high level of, this is old because we're not going to do this anymore, but Asperger's, and the parent came in and said, well, we want an IEP, and we said, well, absolutely, you can request an evaluation. That's your right as a parent. But it appears to me as though the student's 100% proficient on the MEP test. They've not had any behavioral issues. There are no social issues reported, and they're getting all A's in middle school. I don't see how the disability is affecting the student. Now, we pushed through the evaluation. The student didn't qualify. This one was a lengthy, contentious issue. And it went actually to an ALJ, to an administrative law judge, and he sided with the district and said there is absolutely no educational impact for this student because of the data that's shown. And yes, we agree that there is a diagnosis of this clinical disorder. However, it did not appear or did not show itself in the educational setting. So, okay. Again, baseline data can be from many, many different sources. Starting point for instruction. Describe the target skills with enough detail to give a starting point for instruction. Provide frequency and location data. And that means, where is it going to take place, how long is it needed for, etc. Give a detailed description of the student needs. The student needs are important because we need to make sure that everything that we do in the IEP is addressing those student needs specifically. And we'll talk about goals a little bit. Now, this was recently changed. It was actually in the rules package from October of 2011. Districts really didn't start implementing until the beginning of this year. But in the state of Michigan, we used to write goals and objectives that, well, first of all, in IDEA there is no requirement for objectives unless the student has functional deficits, which would mean low functioning cognitive impairment or ASD. There's no requirement for objectives or short-term benchmarks. In Michigan, we always did that because we thought it was, really meeting the needs of the goal. So we would typically write a goal that was very broad, improve reading skills. And then we'd write detailed objectives that would say, Johnny is going to work on CVCE words, improve reading fluency, and work on prefixes and suffixes, with the idea that it was going to improve his reading skills. While the federal government came in and monitored the state and said, we love this, and this is very detailed, and that's great. However, Can you be sure that by CVCE words and prefixes and suffixes that Johnny's going to actually improve his reading skills, and how do you know? Well, you don't, because we never measured the actual goal. So the federal government said, Michigan, you have to now have all of your annual goals measurable, not just the objectives measurable. So there's been a change, and you'll start seeing this in IEPs. You're going to see something that looks like this. By June 2014, Johnny will do this skill as measured by this and documented by this. So there's no question whether or not that goal has been achieved. Now, we still have the requirement in our Michigan rules that says that we have to have short-term objectives and/or benchmarks. Okay? So that's still being looked at. There's going to be a new Michigan rules package that probably comes out in the fall. We're hoping fall, maybe winter. And the idea is that they're probably going to remove the requirement for objectives since we're writing all the goals as measurable. So stay tuned. Again, critical components of a goal: meaningful, measurable, able to be monitored, aligns with the PLAF, and it may align with the grade level content standards depending on where the student is functioning. This is what a measurable goal looks like, and this is actually a model that the Michigan Department of Education provided for educators. And basically kind of follows that same mold that I just told you, but it's, you know, by this date, the student will do this skill when under this condition as measured by this. And that's what all the goals should be looking like now. And this could be for any number of areas that the student is working in. And it's also social emotional goals, behavioral goals, functional goals, adaptive goals. So it's not just those academic goals. It's probably easier to write this in this way for academic goals than it is for social emotional goals and some of those other areas. Progress reports. It's recommended that reporting on goals and objectives go home with a typical report card cycle. And must report on all the goals, benchmarks, or objectives and ensure that reporting is accessible upon demand. And that's important. I'm the compliance monitor for Kent County. When we go in, and I work typically with monitors from the state, or I do it by myself sometimes, but we look at, there's a lot of data that may not be kept up to date and accessible upon demand, and one of the things I ask for when there's a state complaint filed or there's a compliance issue is show me the data, show me the log, show me the accommodations that you've been providing the student that's written in the IEP. And a lot of times there's not documentation for that, and that's a problem. So make sure that everything that's being done, and if you're part of that, it's very important that you document everything that you do. Benchmarks and objectives, again, they're kind of just short-term steps toward achieving the goal, and we used to really focus on them. Now we've, I mean, they're still a requirement, but they can be written, as long as the goal is written as measurable, you can use what are called benchmarks as opposed to separate skills. Separate skills would be objectives, but benchmarks would be time-limited steps toward achieving the goal. So if you're going to require the goal be achieved at 80%, and the current, as identified in the PLAF, the student is currently functioning in that area at 40%, it could look like this. If I'm writing by next June, it could look like this. By October, he's going to increase to 50. By January, he's going to increase to 60. By March, he's going to increase to 70, and then by June, he'll complete the goal. Evaluation procedures are what you actually are going to do to collect the progress. Performance criteria is, you know, how do you evaluate the measurable goals and benchmarks? Consider the target rate or frequency. In other words, 80%, 4 out of 5 times, etc. And then the schedule of evaluation is different than the evaluation procedures and the criteria, because it's really how often you're going to measure progress. Now, I said earlier that you have to report progress minimally at the same time as report cards, but you have to measure progress much more frequently than you would reporting it. You know, typically we measure progress weekly, bi-weekly, monthly in certain situations. That's about as long as you go. And that's really just determining whether or not what's been written as a goal is actually, we're actually moving toward reaching that goal. So the idea is you have a target, your annual goal, you instruct or provide service, measure. If it's not successful, change what we're doing toward reaching that goal. A lot of times you'll see goals written the same thing year after year after year, and I question, well, if it didn't work one year, why do you think it's going to work the next year? And, so we need to really do a good job of assessing data. Again, we talked about that, but it should really be ongoing. Data collection should be. If there are services being provided to a student frequently, the more frequently the services are provided, the instruction is provided, the more frequently the data should be collected. And who can collect data? Anybody that works with the student. Anybody that works with the student. Now, it could be that a special education provider has designed a method for collection and would ask someone else to collect that data. Okay, so that's feasible. Because the provider, if they're coming in once a month, they need data more than that. They can't tell if what they're doing is going to work unless they have that data to back it up. So, other components of the IEP. Special factors, supplementary aids, and services. Always consider what are needed for special factors, i.e. positive behavioral intervention supports. Record supplementary aids and program modifications. Include frequency and timeline and location. We get a lot of this, and that's a recipe for failure. And I haven't seen it much recently, but that's a recipe for failure. Because if you're going to write an accommodation in an IEP for a student, it's determined by the IEP team that student needs that accommodation. Well, if the student is the one that's going to be asked to provide the need, or I need it now or I don't need it now, what if they don't ask all year? Did they really need the accommodation? Well, the IEP team said yes. But if we write in that it's by student request or teacher discretion, it doesn't work. So when you write that in, that's why there should be frequency and timeline. In other words, how often, if there's an accommodation or a supplementary aid, when do they need it and in what circumstances do they need it? If they don't need it, don't write it in the IEP. And that's another thing we get into with accommodations, and we'll list 20 accommodations for a general education teacher that's got 35 kids in the classroom. Well, is that realistic? Probably not. If the student needs more support than they can get in the general education classroom, then that's a program change, not more accommodations in the classroom. So that's a tricky one right there. I've seen IEPs that do literally have 20 to 25 accommodations. It's impossible to provide those during the course of a school day, and it's not benefiting the student. And then it's required that all be documented every time those are provided. So every time that's provided, if you're recording on 25 accommodations, that doesn't allow you any other time to do anything else. Accommodations are what the student would benefit from, but what she requires to progress the general curriculum and work toward attainment of the goals. Accommodations should level the playing field but not give the student an unfair advantage. Who determines them? Gen ed teachers, providers, special ed teachers, depends on the situation the student is in. If a student's going to go into general education classes, really that teacher should be a strong part of what's being provided for accommodations. Documentation, again, we talked about that. You have to document, there's 2 requirements for document accommodations. When it occurred, so date, time, etc., and then what was the result of the accommodation. So if it's extended time on tests, you would have to say it was provided on this date for this test and student achieved 70%. That's just a measure of whether or not the accommodation is successful or not. Programs and services. Before determining program and amount of time, ask the question, when the student's performance level does not match that of their peer group, are there goals and objectives that require specialized instruction that can't be taught within a general setting? Specialized instruction that cannot be taught within a general setting. And they're determined based on the student needs, the goals, and short-term objectives. And we determine a departmentalized program. I don't think you have to worry about that too much. And then calculate the frequency of related services by minutes and sessions. It's not included in the program FTE or full-time equivalent. Address the setting within the location, in other words, where the programs will be located, and then start and end date if it's different from the IEP. Now that may be something that you guys run into because of the start and end date may vary depending on the student's needs in the program and what type of services are being provided by I think it's Kentwood still for the most part in the residential settings, if I'm not mistaken. Related services, there's either direct service and there's consultative service, and those are, they work with the student, they're related to goals and objectives, and the student is on that provider's caseload. Consultation means that the provider observes informally, assesses, or works with the student and provides consult to the professional, the parent, could be the case manager, could be a therapist, etc. So that's typically what that's about for consultation. Now monitoring, there is no goals and objectives, they're not on the caseload of the provider, and it's really, I don't even like monitoring personally, however, it's really typically used when a student is gradually being removed from a service. So if there's now no longer a need, as determined by the IEP team, that the student really needs that direct social work service that they've been getting, there still may be, we don't want the student to fall off and go back to needing it. So there may be some monitoring that occurs just to make sure that they're still doing what they need to be doing. Transportation. It's kind of a tricky one. Special education transportation, when you see that in an IEP, the student, you always see this, the student requires specialized transportation. If the answer is yes, that means that student is on a bus and transported with only special education students. And that was a little bit of a bone of contention too. We had a situation arise, I don't know, maybe a couple months ago, and it was a different ISD, but the district bought a lift bus. And they said, well, this is great, so we're going to transport our own students as opposed to using the ISD transportation, and we're going to buy a lift bus for these students that are in wheelchairs, and we can even have all general education students ride on the bus. Well, and that one student that had the wheelchair in his IEP said he required specialized transportation. The district said, well, this is specialized. Look, we have a lift bus. And they were found to be out of compliance, and they had to provide additional transportation for just one student on a bus, to and from every day. Quite costly. It costs about $60,000 a year to do that for one student. Again, a bus that has general education and regular education student is not considered specialized transportation. You determine the need for specialized transportation. It's not automatic. There has to be a need that's present for specialized transportation. You know, there's reason for needing special education transportation, and it has its implication. No means the students can walk or use general education transportation to get to and from school. If there are no problems on the bus, and this used to be just a commonplace thing. Every time a student was special education, we wrote, yep, special transportation. Well, if a student doesn't need it, they should not be hindered to work with or to be with their peers during that time because they have a label. If they can use the general education, then by all means should use general education. If you write yes, it means the special education program or service is located away from the student's regular attendance area, i.e. could be a regional program, could be a center-based program, could be a residential program. The student has medical, health, developmental, and or behavioral needs that cause him or her to require transportation, special transportation. The medical, health, developmental are pretty self-explanatory. Behavioral sometimes become tricky. And a student who uses general transportation to and from school may need special transportation to and from CBI sites, community-based instruction, when they're going out into the community. So that could be an option as well. There are 3 types of specialized transportation. There's curb to curb, which typically is bus stop. There's corner to corner and door to door. We used to write a lot of door to door. It has to be a very special case that requires a door to door type of transportation because it typically requires a special bus a lot of times too. Not all those very large yellow buses can get into everyone's driveways or cul-de-sacs or dirt roads so it's a pretty specialized case when you really write in door to door for a student. And then extended school year services. ESY is something that sometimes gets overlooked. and ESY is obviously the extended school year services. It is a requirement that for every student that requires specialized instruction, that extended school year services be addressed. Okay? That means that they may require additional service throughout what is atypical for a normal school district, i.e. today is a lot of kids' last day of school. While some kids may still need school during the summertime for a couple of different reasons, and I'll get to that in just a second. Special extended school year refers to special education related services that are provided to a child with a disability beyond the normal school year. Excuse me. Each public agency has to ensure that extended school year services are available, and extended school year services must be provided only if the child's IEP determines on an individual basis that the services are needed for the provision of FAPE. FAPE, again, this is a very common term in special education, free, appropriate public education. It's what the initial act that was developed in 1975, 94-142, was based on, was a free, appropriate public education for all students. There must be at least one current IEP goal where significant concerns exist regarding skill maintenance during a break of service. These are the three areas that you have to consider when determining whether or not a student needs extended school year service. Okay? Goal areas of concern should represent skills essential to the progress of the student, and ESY services must be based on data to determine which, if any, goals represent areas of concern that may present significant difficulties in maintaining skills during service breaks. The law says that these are the three situations under which students may require extended school year. A state may have a serious potential for regression of skills that cannot be recuperated. The nature or severity of the disability could be such that they require it, or there could be a critical stage or area of learning that may be needed to be developed. Okay. I went through it quick.